How do I know if my pet needs emergency care? You must be prepared for the possibility that your companion may require emergency care at any time, regardless of the time of day or night. It is not always straightforward to determine when your pet necessitates emergency care. Therefore, it is crucial to be cognizant of the signs and symptoms that suggest that a visit to the emergency vet is necessary. If you are uncertain, consult your veterinarian or an emergency veterinary clinic. Symptoms of a health emergency in your animal. An emergency in your companion may manifest as injuries, a sudden onset of illness or disease, the ingestion of a foreign object, or an accident that results in bodily trauma. The following are some of the most prevalent indicators that it is time to seek emergency veterinary care. Seizures, dilation of the irises, abdominal swelling, bloating, or discomfort, weakness or the inability to walk, car accidents, severe injuries, fractures, and cuts, uncontrolled hemorrhaging, dizziness, inability to excrete or defecate, eye inflammation or injury, unable to deliver puppies or kittens, a sudden onset of blindness, stumbling, or faltering, choking, difficulty inhaling, or severe coughing, ingestion of substances, foods, bones, or vegetation that are poisonous, readily apparent pain, hemorrhage or vomiting following diarrhea, unaware, fundamental first aid. Several critical stages are involved in the provision of basic first aid for animals to address injuries or sudden health issues until professional veterinary care can be accessed. The following is a comprehensive guide to assist you in administering initial care. 1. Evaluate the circumstances. Safety priority. Guarantee the safety of both the animal and yourself. It is advisable to refrain from being bitten or clawed, particularly if the animal is in distress or frightened. Inspect the animal's health. Observe for indications of distress, including unconsciousness, difficulty breathing, or excessive hemorrhaging. 2. Manage bleeding. Apply pressure. Apply gentle pressure directly to the laceration using a clean cloth or bandage. Continue to apply pressure until the hemorrhage ceases or professional assistance is rendered. Elevate the wound. To minimize blood flow to the injured area, elevate above the heart if feasible. 3. Protect and clean wounds. Gently cleanse the wound with lukewarm water if the bleeding has ceased and the laceration is minor. Refrain from employing hydrogen peroxide or alcohol, as they have the potential to cause tissue irritation. Cover the laceration with a sterile bandage or gauze pad to prevent further injury and infection. Apply a bandage, maintain the cleanliness of the area, and replace the bandage regularly. 4. Manage breathing disorders. Check for inhaling. If the animal is not inhaling, it may be necessary to administer cardiopulmonary resuscitation (CPR). This entails chest compressions and rescue breaths for canines and cats. However, it is imperative to obtain specific instructions from a veterinarian or an animal first aid course. Clear the airway. If the animal is suffocating, thoroughly inspect the mouth for any obstructions and attempt to remove them if it is safe to do so. 5. Provide shock treatment. Prevent shock. Position the animal on a heated surface or blanket to maintain body temperature. If they are experiencing frigid temperatures, drape them with a blanket. Minimize stress. Ensure that the animal is as comfortable and tranquil as we can. Refrain from making sudden movements or making loud sounds. 6. Manage poisoning or toxins. Poison identification. If you are aware or suspect that the animal has consumed a toxic substance, attempt to identify it. The veterinarian will require this information. Consult with a veterinarian. Immediately contact a veterinarian. Do not induce vomiting unless directed to do so by a veterinarian, as certain substances can cause more injury if regurgitated. 7. Manage injuries and fractures. Immobilize the area. If you suspect a fracture, gently immobilize the afflicted limb using a splint or a makeshift support egg, a rolled-up magazine. Refrain from transporting the animal beyond what is necessary. 8. Monitor vital signs. Monitor respiration and pulse. Maintain consistent monitoring of the animal's respiration rate and pulse. This information is potentially beneficial to veterinarians. Keep a record of your symptoms. Please document any modifications in behavior, appetite, or symptoms to furnish the veterinarian with comprehensive information. 9. Animal transportation. Ensure the animal is handled with care when transporting it to a veterinarian to prevent additional harm. If necessary, employ a durable carrier or construct a temporary stretcher. 10. Seek the assistance of a professional. Consult a veterinarian. It is imperative to obtain professional veterinary care as quickly as possible, even if you have administered first aid. Additional suggestions regarding aids. First aid kit. Maintain a first aid kit that is tailored to the needs of pets in your residence. Bandages, antiseptic wipes, forceps, a thermometer, and a muzzle should be included. Acquire fundamental skills. To enhance your preparedness for emergencies, contemplate enrolling in a pet first aid course. Emergency numbers. Ensure that you have the contact information for your veterinarian and local emergency veterinary clinic to hand. Inspect the animal's health. Observe for indications of distress, including unconsciousness, difficulty breathing, or excessive hemorrhaging. First and foremost, safety. Guarantee the safety of both the animal and yourself. It is advisable to refrain from being bitten or clawed, particularly if the animal is in distress or frightened. Inspect the animal's health. Observe for indications of distress, including unconsciousness, difficulty breathing, or excessive hemorrhaging. Several critical stages are involved in the provision of basic first aid for animals to address injuries or sudden health issues until professional veterinary care can be accessed. The following is a comprehensive guide to assist you. It's important to bear in mind that although first aid can offer essential initial support, it is not a substitute for professional veterinary care. Being prepared. One is important to know in advance. In the event of an emergency, our veterinarians advise that the following items be prepared and readily accessible. 1. The telephone number listed for your veterinarian's facility. 2. The telephone number of the nearest emergency veterinary clinic. 3. The Animal Poison Control Center's telephone number. 4. Directions to the emergency vet clinic. 5. Understanding of fundamental pet CPR. 6. Information regarding the cessation of hemorrhaging. 7. How to muzzle your dog to prevent him from biting others when he is in agony. Financial obligations. The cost of emergency care for your companion can be high due to the extensive diagnostic testing, monitoring, and treatment that may be required. It is incumbent upon you as a pet owner to guarantee that you are capable of providing financial support for your companion during a crisis. It may be simpler to prepare for unforeseen circumstances by utilizing emergency savings or pet insurance programs. It is crucial to take this into account when purchasing a pet, as delays in care to prevent emergency fees may endanger your pet's life. The following are 7 alarming indicators that your dog requires emergency care. Do not disregard these symptoms. Ownership of a companion necessitates the ability to identify indicators of emergencies and implement appropriate responses. The most effective method of safeguarding your cherished pet from pain and discomfort is to prevent pet emergencies. Learn the alarming signs of pet emergencies and take the necessary steps to save your companion's life by continuing to read. An abdominal swelling, bloat, or GDV, a severe medical emergency, may be indicated by a firm, swollen belly in your companion. Gastric dilatation and volvulus are fatal conditions that are frequently observed in large canines. This condition occurs when the stomach rotates and fills with air, thereby disconnecting the blood supply. GDV is more prevalent in dogs, particularly larger breeds such as Great Danes, than in cats. Surgery is urgently required to resolve this matter. Toxicology. The incidence of poisoning in pets is not uncommon. Pets frequently consume or interact with hazardous substances in a variety of environments that can result in toxicity. Vomiting, frothing at the mouth, lethargy, and watering eyes are among the most prevalent symptoms of poisoning. Locate the source of the poisoning and transport your companion to emergency care. This can assist in the preservation of your pet's life and the prevention of any complications. Astonishment. Immediate emergency veterinary care is necessary for canines and cats experiencing shock. In small or immature pets, it may be the consequence of severe trauma, heat stroke, or even intense episodes of vomiting and diarrhea. Small dogs, puppies, and kittens are particularly susceptible to shock. However, even large dogs may experience it in severe circumstances, such as automobile accidents. If you observe any indications of distress, it is essential to promptly visit the emergency veterinarian. Intense ache. Another reason to seek urgent attention from an emergency vet is severe pain. Although injuries are frequently the source of severe pain, they may also suggest the presence of other underlying conditions. It is always advisable to consult the veterinarian if you suspect that your dog is in severe pain, particularly if the pain is severe.